Welcome to the Concussion Summit. Today we're here with Dr. Abbey from the Neurologic Wellness Institute in Wooddale, Illinois, and she's going to talk about cognition and concussion. Because our center is typically a vestibular rehab and physical rehab and neurological rehab center, most people might equate our clinic to dizziness or headaches or chronic pain or dysautonomia, but we see a lot of people who obviously have cognitive issues, memory issues, personality issues, mood disorders, and these are brain fog. Although while we do therapy to the body, we see often cognitive improvements. And so thank you for being here, and I'm excited to talk to you about cognition and how it relates to concussions and what patients can do to improve their cognition who might be suffering from post-concussive syndrome.
Yes, thank you so much for having me. I'm excited to talk about it.
So let's get right into it. So tell me, right off the bat, how common is cognitive problems in concussion? How often do you see it in your practice? What other symptoms do you see associated with it that are also common?
Yeah, so anytime there's a concussion, we often all the time see there is some cognitive impairment, whether it's slight to moderate to more severe. And with that, we see a lot of things from attention and concentration issues, from processing and understanding information, memory, communication, planning and organizing. So it can be presented differently between each person and depending on their concussion, but we do see cognitive impairments in most of the concussions that come through our clinic.
And why do you think that is? Why do you think concussions are correlated so much with cognitive issues?
Yeah, so with all concussions, it primarily affects our frontal lobe. And our frontal lobe is where all of our higher cognitive functions are processed. And so when we have an injury or damage to that area, we'll see things that kind of correspond with the cognitive impairment.
Okay. And then of these cognitive issues, what are the most common ones that you're seeing every day in your practice?
Yeah, so most common we see is trouble with memory, inability to pay attention, slower reaction time, increased sensitivity, whether it is to sound or light, even emotional, problems with decision making, and even impulse control.
And a lot of people might be sitting at home without a concussion and think, my memory is not so great, or, some of these things might ring a bell. What kind of testing do you do to differentiate people who might have a little bit of memory issues just from aging or just from lifestyle versus someone who might be suffering more significantly after an injury or concussion?
Yes, definitely. So we have a program here at the C3, which is good for measuring cognitive function, especially when it comes to after brain injury or concussion. So it's a really good baseline that we can measure processing speed, memory, concentration, and it gives us a really good baseline in determining if that is indicative of someone who has suffered with a concussion versus maybe someone who is just having these kind of frontal lobe findings without an injury.
Absolutely. What I always find interesting is because it's in the frontal lobe is also involved with walking and gait and posture. And so can you talk a little bit about correlations that you've seen with some people who have a combination of postural problems, balance or walking problems, but also cognitive problems, but they might be more aware of the walking and the balance, and they might not be as aware of the actual cognition?
Yes, definitely. So we will see a lot of people say, I feel more unstable. I can't really feel where I am in space, right? And the frontal lobe really plays a primary role in our movement, right? And not only our movement and our gait, but also our cognition. So it's not abnormal to see these things kind of come together and coincide with one another.
Absolutely. And as far as therapy, what do you typically like to do therapeutically with patients with cognitive issues after a concussion?
Yeah, so there's a lot of different things that we can implement, whether it's proper nutrition to help kind of decrease some of that inflammatory cascade that happens with concussions. We also do neurofeedback to help with some of the brain frequencies. And then we do a lot of cognitive tests. So we have a lot of iPad tests that we do to help improve blood flow to specifically the frontal lobes to help kind of retrain and get those areas working a little bit better. We also do things like electrical stimulation to certain areas of the brain. And then we also do a lot with the eyes. Certain eye movements correspond to different regions of the brain. And we have specific eye movements that correspond specifically to the frontal lobe. So we can utilize eye movements a lot to, again, help retrain that area of the brain that isn't really working optimally as it should. And then we have balancing, complex balancing tasks that we can also implement just to kind of help target the whole system.
So with concussion, it was only a few years ago that people wanted to sit in a dark room and rest. And it seems over the last 10 years or so that there's been much more emphasis on exercise and activity and for cognition, cognitive exercises. But it seems like we still have a long way to go to really understand concussions and cognition. Based on all your reading and all the research you've read, what's your opinion on concussions, cognition, assessment, and treatment of it?
Yeah, definitely. And research is just showing more and more that treating these cognitive impairments that happen with concussions is very critical, just because it plays a critical role in our everyday behavior and our social behavior. And as we age, we tend to decline cognitively. So it's really important that if there is an injury or an impairment that's happening, especially at a young age, to address it as quickly as you can to help make those changes sooner rather than later. Our brain is very plastic. As we know, neuroplasticity can go both ways, It can help change the brain, but we can also be implementing behaviors and pushing this cognitive impairment for years and years and years that create this permanent pattern that's harder to address when we kind of just sit back and rest and let it take its course.
Absolutely. And I think it's really important, something you touched on, is most people, they might think concussions as headaches or pain or dizziness. But when I talk to patients, a lot of times, I talk to parents whose kids have concussions and they just had a concussion. They'll ask me, what do I look for? I always tell them you want to also look for changes in behavior, judgments, decision-making, irritability, because these are the things, while a headache can bother you and disable you the rest of your life, if it's bad enough, these other things can really affect your life also. And so if all of a sudden you start making poor decisions, there's a high risk of increased alcohol or drug dependency. And so when you start looking at executive function, it's not always just, I can't remember something. Your whole processing and decision-making of your life can alter, and that could drastically alter the direction of your life after a concussion versus before a concussion. And so I think when you start looking at concussions, it's a lot more than just physical healing. I think you have to also kind of redirect people's lives, because if their decision making is altered, then everything they do could be altered.
100%. Yeah, exactly.
Well, thank you so much for being here. I really appreciate our talk, and have a great day.
Thank you. Thank you so much for having me.